This week is an Arthritis Special as I answer some of the questions put to me on my recent live chat with Hannah from the fabulous Canine Arthritis Management. And as a result, I'm going to be talking all about the potential side effects of some of the drugs that we can give to treat arthritis, some of the painkillers. I want to talk to you about the likelihood of your dog from suffering arthritis later on in life if they have a problem with their joint when they're younger. And I also want to talk about what you can do to help kind of mitigate that damage, to help reduce the risk of arthritis, or to help reduce the impact that arthritis has on your dog. But before we get into all that, here's the intro.
Welcome to Call the Vet, the show that answers all your dog and cat questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hi, and welcome to the 25th episode of Call the Vet. I'm Dr. Alex, the veterinarian behind ourpetshealth.com, and my aim on this show is to give you information that you need to help you look after your pet to the best of your ability so that they can live healthier, happier lives. So thanks for tuning into today's show to talk about a topic that really is close to my heart. Arthritis, it's a super common condition that affects a really large proportion of our pet dogs and cats, and it's actually one of the biggest impactors of quality of life of our pets. And unfortunately, all too often it's ignored. It's passed off as a pet just getting old, them getting stiff, them getting slow. There's nothing that we can do about it, or we only do a few things out of all of the potential options there are in our toolkit to help tackle this debilitating disease. And let's make no mistake about it, arthritis is debilitating and is frequently the cause of early euthanasia. Were that disease managed more effectively, then our pets could be happier for longer and they could also be with us for longer. So clearly this is a very important topic. And like I said in the intro, the questions kind of on today's show are to answer some of the questions that were asked during a live chat I had with Hannah, who's the founder of Canine Arthritis Management, who has a fantastic website and a fantastic Facebook group that I'll link to in the show notes. And I was over there having a live chat with her about some of the challenges as a general practitioner, kind of on the front line of pet healthcare when it comes to dealing with arthritis, to tackle some of the problems that we frequently come up against. And there were some great questions answered by the community that I'm going to hopefully address today. But just before we get into those, if you enjoy the show, then make sure you're subscribed to the podcast. I've got loads more valuable episodes lined up that you definitely won't want to miss. And you can also get your question answered about anything to do with your pet's health, how to look after them, what problems that they're suffering with, any questions about treatment or diagnosis or prognosis or anything at all related to their care. Get those questions answered just by heading over to callthevet.org and submitting your question. And the first question was from Barbara, who knows the challenge that stairs can cause to our arthritic pets, but has got a set of stairs and a garden where climbing stairs is unavoidable. And she was wondering if walking up and down steps slowly was less damaging than going up and down them quickly. So her dog is kind of quite prone to tearing around and kind of running up them or leaping down them and is concerned that that might be causing problems. So the very short answer is that yes, walking slowly is definitely going to be less damaging than going up and down them quickly. And there's a couple of reasons for that. So going quickly, be that running or if your dog is jumping, just means that they're going to put a lot more force through their joint. Now, if we do that repeatedly, we have these same routines that we do. We have maybe the same walk we go on, or we're letting our dog jump into the car every time. All of that repetition is going to have a compounding effect. And if we're kind of having larger forces going through those joints every time, then we're more likely to cause damage to those joints. We're going to get more inflammation, especially in joints that are already inflamed, that are already abnormal. And also, if your dog is running up and down stairs, they're more likely to trip or slip or stumble or fall and hurt themselves and sprain their joint, which is going to kind of cause a flare up of their arthritis, cause more inflammation, cause more pain, and ultimately is going to cause more damage. So if we can slow our dog down, and I know that sometimes that's not easy, they're pretty enthusiastic in what they do, especially if our arthritis plan is working really well otherwise, and is keeping them comfortable, then they're going to potentially want to do things that aren't in their best interest. And so then that comes down to us to try and put steps in place just to reduce those impactful events, if you like. So other things like ball throwing, I'll kind of discuss in a little bit with another question. But, if we can't avoid these things, then we can try and mitigate them. We can try and modify and take steps to just reduce their impact. So in this case, yes, we can't avoid steps. There's no way that we could put ramps up them, for example. Then just holding on to your dog on a lead while they've got a harness on and helping them up there, helping them stay nice and slow and steady is definitely going to make an impact in the long run. Because if they're having high impact going through their joints regularly, then that's going to be more likely to cause a more rapid deterioration than otherwise might be the case. And that brings me nicely on to the next question, which was from Patricia, who has a young cockapoo, who was asking, does hip problems in younger dogs mean that it's more likely to develop arthritis? And if so, how can this be prevented? So the unfortunate answer is that yes, if we've got joint problems of any kind, then there's more likely that there's going to be a chance of arthritis. There's definitely things, though, that we can do to kind of reduce the impact that has, reduce the speed of that developing, which I guess is the good news. And really well done to Patricia for recognizing that this might be a problem and wanting to know the steps that she can take. Because if we can take action in the early stages with dogs that are at risk or suffering from the very early stages of arthritis, then they're going to have much more of an impact than we're waiting for if our dogs become crippled, or are waiting until our dogs become crippled before we're actually taking steps. So I guess also at this stage we should say that kind of it does depend a little bit on what the hip problem is, because a hip problem might mean that there is actually a muscle injury that isn't necessarily going to cause arthritis or increase the likelihood of arthritis later on. So it does depend a little bit on what that hip problem is, but assuming that it involves the bones, so that could be like a hip dysplasia problem or maybe a little fracture or whatever it is, then yeah, definitely arthritis is going to be a concern, and we want to be taking steps really in the early stages. So the first thing that I'll often say to people is weight management is absolutely vital. So going back to reducing the impact on joints in the last question from Barbara, really, if we can reduce our pet's weight, we can have a massive impact on the amount of forces going through their joints. And over a lifetime, that can have a really huge impact. So we know that obesity, it's another passion of mine, that we're in the middle of an obesity crisis with our dogs and cats as well as ourselves. And it has such an impact on quality of life. So we also know from various studies that an overweight dog is going to get arthritis an awful lot earlier than a dog otherwise is prone to arthritis would be were they a healthy weight. We also know that they're more likely to be euthanized potentially up to 2 years earlier as well than a dog who is a healthy weight. So we can't overestimate the importance of keeping your dog a healthy weight, especially in a dog who's going to be prone to arthritis. So if you've got any doubts about how to, about what your dog's ideal weight is, or how to know if they're an ideal weight, then I'll leave some links in the show notes to some posts I've got about how to condition score your dog, but also talk to your vet, ask them what your dog's ideal weight is, and take steps to either correct that if they are overweight, or just really closely monitor it so that you maintain that nice healthy body condition. So the other thing we can do, which again goes back to the last question, is to reduce some of the high impact events that can happen in your dog's everyday life. So that could be jumping into and out of the car. And remember, kind of jumping it's something like it causes 10 times the amount of force to go through a joint than otherwise would be the case. But things like ball throwing, and I know over Cam, Hannah is passionate about getting rid of those ball chuckers because it just acts, we absolutely run our dogs ragged if we're throwing balls for them. It's a really high motivating thing. Some dogs will become absolutely fixated on chasing that ball, and they want nothing more than to do that 24/7, and they won't stop when they get tired. They're going to be more prone to injury. It's going to be having a massive impact on those forces as again going through their joints. But ball throwing is a big one. Yeah, jumping into the car. Also, we want to be maintaining that muscle mass. So the last thing we want to be doing is to be completely resting our dogs, to be letting their muscle all kind of atrophy through disuse. Actually having a really nice, firm, strong muscle group around a joint helps to stabilize a joint. It helps to protect against injury. And we can ensure that by doing things like hydrotherapy, by having appropriate levels of exercise and appropriate types of exercise, by having physiotherapy. There's all kinds of different things that we can do to maintain that muscle mass, but certainly in a young dog, that's going to be very important as well. Supplementation is something that we want to consider at the same time. And I spoke a lot about this with Hannah over on that live chat. And again, I'll leave that link in the description. But really, if we're jumping on the supplement bandwagon, and a lot of people, that's the first thing that they consider, well, actually that's very appropriate, especially in the early stages of the disease. The best supplements out there are essential fatty acids. They're the ones with the most evidence behind them to say that they work. There are also various other supplement options out there, some of which are better than others, but we also want that essential fatty acids, that's our omega-3 fatty acids, especially to come from a marine source. So a fish oil, a green lip mussel extract, krill oil, something like that is what we want to be looking at. So that's another thing that we can do to help reduce the impact of this hip injury in Patricia's dog case, resulting in arthritis later on in life. Like I say, taking action as well is really important. So if we're doing all of these things, we're maintaining a nice healthy weight, we are reducing our impactful events, so not ball throwing, we're trying to reduce the jumping in and out of the car, for example, kind of running up steps, leaping up steps, all that kind of thing, and taking steps to maintain that muscle mass, then you're going to be kind of in the best place to help just reduce the impact that this will have on your dog. And then the last thing I would say is actually just closely monitoring your dog for signs of pain. So if we know that arthritis is more or less an inevitability, then we just want to be having a close eye and keeping a close eye on our dog, so that when they start showing the really earlier signs of pain, we can take additional steps to help reduce the impact that arthritis has on their life. And arthritis is unfortunately a progressive disease. It is going to get worse with time. It's also a dynamic disease, so we'll have periods where the pain levels seem worse and the disease seems less controlled. And in the same way, we'll have times when the disease isn't quite so bad. So we need to be really closely monitoring our dogs, and that goes for whatever stage of arthritis they are in, so that if our treatment plan isn't working as well as we would like, we can actually take steps to intervene to make it better and to make their quality of life, their comfort levels better. And then at this point, I just wanted to let you know that this episode is brought to you by my arthritis mini course. So I've got a free email course that just runs you through a whole load of different aspects of arthritis. It takes it in really bite-sized chunks. It directs you to further resources that you'll be interested in that will help you manage this condition better. It also contains a number of other free downloads, like a pain monitoring chart, just so that it's very easy for you to keep an eye on whether your dog is becoming more painful or whether their treatment plan is really well controlled. So if this free arthritis mini course is something you're interested in, you can sign up today just by heading to ourpetshealth.com/arthritis mini course, and I'll also leave a link in the show notes as well.
Get your questions answered at callthevet.org.
And then my next question was a really kind of common concern. So Lorna and Kate and Malcolm and Debbie, they all expressed concern about their dog taking painkillers, particularly non-steroidal anti-inflammatory. So that might be Loxicom, there was Metacam, there was Onsior, but whatever it is, they're non-steroidal drugs. So there was concern that their dogs were taking these long term, and what were the side effects? Was it going to cause real problems with their kidneys, with their liver? Were they going to suffer? Were they going to have a shorter life as a result of taking these? And were there alternatives? So it really kind of makes me quite frustrated and also sad when people are really scared of the side effects that they've heard of, generally from the internet or from some kind of well-meaning person who might have read an article somewhere about something about painkillers. And as a result of these kind of fears that they're not even considering kind of using this drug class, because, and I completely understand, we absolutely don't want to be giving anything to our pets that has a kind of a significant chance of causing some real serious problems, kind of harming them, ultimately being life-threatening. We don't want that, but it's also important not to over-exaggerate these risks to kind of make them far more serious than far more common than they are. And also this class of drugs, so our non-steroidal anti-inflammatories or our NSAIDs or non-steroidals, whatever it is you call them, they really do offer one of the best chances of a pain-free life for our arthritic pets. They really are the cornerstone of our pharmaceutical arthritis management. So they do a fantastic job of reducing inflammation. They do a fantastic job of controlling pain. And they really shouldn't be ignored, or they shouldn't be passed over because of some potential side effect. Now, that's not to say that there aren't side effects with non-steroidal anti-inflammatories. There absolutely are. So, that's somewhere between about 3 to 9% of dogs are reported to experience side effects with non-steroidals. But before you jump onto that, the massive majority of these side effects, they're limited to a little bit of vomiting, a little bit of diarrhea that goes away when the drug is stopped. Now, also very often, our dogs, they're eating horrible things. They're going on walks, they're sniffing and licking and all kinds of things. And so our dogs will develop vomiting, will develop diarrhea anyway. So I think very often as well, it might be that the non-steroidal didn't necessarily cause the vomiting or diarrhea alone. It just might not have helped. It might have made it a little bit worse than it was otherwise going to be. But we take that non-steroidal away. We give normal supportive care, so normal dietary management. Maybe if we've got concerns that it was a reaction to the non-steroidal, we can give some antacids, some gastroprotectants, so some things to kind of help the healing of any ulcer, and the vomiting or diarrhea quickly stops without any further intervention, without any harm done. And very often we'll start that again, or we'll try a different non-steroidal, and the problem won't recur, and there'll be no further episodes of vomiting or diarrhea, or certainly not as a result of being given the drug. So there does appear also to be kind of an individual reaction to specific non-steroidals. So some dogs will get on better with some than with others, but really it's an absolutely tiny proportion that will then go on to experience any more serious side effects. So just sticking, before we kind of move on to those other side effects, sticking with our intestinal problems, there are absolutely problems if a dog is vomiting already, or if they've got diarrhea already, and we're still giving these drugs despite that, then yes, we can get some serious ulceration, and also ultimately we can get a stomach ulcer that perforates. And if that happens, that's bad news. That is really highly likely to be fatal, or certainly kind of compromise the survivability of your dog. So we absolutely need to stop non-steroidals if there are concerns with intestinal upset. If there's other intestinal pathology going on that makes that more likely to occur, then non-steroidals also aren't going to be appropriate. Now, moving on to the other serious side effects that our dogs can experience are kind of liver disease and kidney disease are, I guess, the key ones that a lot of people have heard about. Now, some dogs will develop an idiosyncratic reaction, which means that there's no predicting that's going to happen, whereby it causes liver problems, it can cause liver failure, and ultimately there is a very tiny chance that it could potentially be fatal, but that really is very, very uncommon. Personally, I've never come across that in my career. I've been practicing since 2006, use these drugs every day, and I've never knowingly had that happen to any patient of mine. The other potential problem that we can get is if there is a dog who's got kidney disease, then it can make that condition worse. But really, it can make that condition worse, especially if they become unwell, if they become a little bit dehydrated. And the reason for this is that it can depress the normal protective kind of function that kicks in a dog to maintain blood flow to the kidneys, that can then cause more kidney damage and can ultimately cause kidney failure. So there is a chance of that happening, but like I say, whether the drug is actually causing the kidney problem, really, I have my doubts. I think that it's more likely, if that's the case, there is an underlying kidney condition, and then a dog will get sick, they'll get a little bit dehydrated, we'll keep giving this drug despite them being unwell, and then that can absolutely cause really severe problems. Now, there are going to be a subset of patients where this does hit them out of the blue, but really, again, this is really, really tiny problem. And again, I don't know that I've had a patient of mine who has been monitored properly who's ever had a problem with this developing to such an extent that it causes any kind of life compromising problems. Now, that said, we need to use these appropriately. So the normal way that we use non-steroidal drugs in a long-term situation is by closely monitoring a patient. So we're not just closely monitoring their pain, we're also closely monitoring their appetite, their general demeanor, how well they're drinking, and we're also taking regular blood tests. So very often we'll take a blood test before we start long-term treatment to get a baseline level, to check that there's been no kind of funny reaction from the liver to suggest that there's caused problems already, or just to check that there's no problems, other problems that we need to be aware of. We're then going to take bloods intermittently. Now, at the start of treatment, that's going to be more regular, but once we've got a nice baseline, we know that our dog is nice and stable, that there's no concerns with developing liver disease, there's no concerns with developing renal failure, then that might be every 3 months. It might go down to every 6 months. It might, depending on your dog's age and depending on your kind of attitude to this, if you like, it might be every 12 months. But that's really something to discuss with your vet about the best protocol for your dog. Taking a urine sample is also going to be a good idea, and it might be that you drop off a urine sample kind of in between blood samples just to check that they're still able to concentrate their urine, and so there's no concern about developing kidney disease. So, absolutely, we should be monitoring our dogs closely. We don't want to be using these drugs kind of willy-nilly and haphazardly and ultimately irresponsibly. So blood testing really is important. Other things we can do to reduce the risk of side effects. So if your dog is vomiting or if they develop diarrhea, then absolutely stop these drugs. Let everything settle down. Potentially get in touch with your vet and don't start them up again until your dog has been well for a number of days. We also should stop if your pet appears to be depressed, if they're becoming unwell, if they stop eating or drinking, just so that we're not getting into a situation where we're giving a drug that can cause extra problems if any dehydration is present. We don't want to give a higher dose than your vet has prescribed. That does happen. Or my dog dog seemed a little bit sore, so I gave them an extra half dose or an extra dose of the medication. Don't do that, because that could be an overdose and that can cause problems. Also, we don't want to give it at the same time as steroids. So if you're tempted to give your dog any other treatment, or if you take them to an after-hours vet, for example, make sure that they know that they are on long-term medication, and that goes for whatever medication they're on. We don't want to use at the same time as another non-steroidal, so we don't want to use any human painkillers either, unless specifically advised to by your vet. So paracetamol, that's something that we can use in dogs and doesn't react with non-steroidal, so it might be that your vet recommends that. But if they're on a non-steroidal, so like Rimadyl, like Onsior or Metacam or whatever it is, don't be tempted to give them a little bit of aspirin or a little bit of ibuprofen if they're looking a little bit more painful, because that's going to cause problems. Also, we want to be contacting our vet if there are any concerns with treatment. And this goes for anything. Having a close relationship with your vet is really important when we're managing a chronic situation, a chronic disease, especially one that does deteriorate with time and does kind of wax and wane, because we're going to have to, change our management plan, make sure that our dog is as comfortable as possible. So really keeping in close contact with your vet, but especially if you've got any other concerns. And then other things we can do, we want to use other management and treatment strategies for arthritis and any chronic pain condition to reduce the dose of non-steroidal drugs that we're potentially needing to use to keep our pet pain free as well. And then finally, kind of on the topic of drug administration, there are going to be dogs that non-steroidals just aren't appropriate. Maybe they've had a reaction, maybe they've got another condition. Very often we're dealing with older animals who might already have advanced kidney failure, for example, or might have other problems. They might have problems with their gut. They might have an inflammatory bowel disease, where we don't necessarily want to be giving them long-term non-steroidal anti-inflammatories. It might be that they've got a clotting disorder. That's one other condition where we wouldn't want to be giving anti-inflammatories. It might be that they need steroids to control another problem, and so that takes non-steroidals off the cards. And there are other painkillers that we can use, so that can include things like paracetamol, like I said, like gabapentin, like amantadine. There are a number of other options available. So painkillers doesn't mean just non-steroidals by any stretch of the imagination. For our advanced cases, it will often mean multiple drugs. So that could be 2 or 3 drugs being given at the same time, just to keep your pet really nice and comfortable and able to live their best life possible. But these drugs can also be given without non-steroidals. They may not work, as well. They may not have as big an effect, but they can still have a massive impact on your dog's quality of life. So I guess the take-home message that I often like to leave when I'm talking about this topic is that, yes, there is the risk of side effects. Some of those side effects can be severe, and some of those side effects can be life-threatening, but, and it's a big but, those are incredibly rare. And we've got to weigh up the massive benefit that drugs can bring to the comfort levels, to the quality of life of our dogs in chronic pain. So in my mind, it's a fine balance. We don't want to use them inappropriately, like I keep saying, but neither do we want our dog to be living in pain that is unnecessary, having a miserable life, having no quality of life, not able to enjoy anything that they would normally enjoy, not being able to go for walks because we're not willing to give them drugs that could take their pain away. It's really unfortunate. It's really sad for those individuals that do have side effects and do have nasty side effects, but they are very, very much in the minority. And the vast majority of dogs, especially if we're using them appropriately, if we're selecting our cases, if we're managing them closely, if we're taking steps to avoid the side effects, the vast majority of dogs will not have any problem from their drugs, and they offer the best chance of your dog living their best possible life. And then the final question for me to answer today was from June, who was asking, does hot weather have a bad effect on dogs with arthritis as much as cold weather? Because June's Labrador seems to swell in the heat and seems to limp much more. Now, I have to say, I didn't really know the answer to this. It's something that I had to have a little look into. So, we're all aware of the fact that cold weather seems to cause arthritis to worsen. And the reason for that seems to be to do with actually barometric pressure rather than the temperature as such, although the two do go hand in hand. Now, in hot weather, what can happen is we can get blood vessel dilation. So the blood vessels, they become wider in an attempt to lose heat so that the body doesn't overheat. And this causes changes in the fluid levels in different places in the body, and also salt changes and things like that with panting and potential mild dehydration. And the hot weather causes increased fluid to form in the joint. So we get an increase in joint fluid, which causes an increased pressure within the joint, which causes an increase in pain. So, absolutely, there is a potential cause of hot weather resulting in worsening of arthritis, although that's not normally the kind of the way around that we see it, certainly in the UK or in New Zealand where I am. We normally see arthritis worsen in cold weather. But really the bottom line is, and kind of what I suggested to June, was that if you do notice something that makes your dog more painful, it doesn't matter if that's a normal thing. If you are noticing something, then take steps to try and mitigate that event. So it might be that you can't avoid it. Well, you can't do very much about the weather getting hot, but you can try and keep your dog cool. So, make sure they've got shade, have a sprinkler or a paddling pool so they can, stay wet and stay cool, have plenty of fresh water, potentially put ice in the water or have it in the fridge and just regularly freshen their water bowl. Have a fan in the house, have cold wraps or mats, walk your dog early in the morning or late at night when it's a little bit cooler, have various ice treats, that kind of thing. So in June's case, if you've noticed this, fantastic. Well done for actually spotting a link to something that's causing your dog to be more painful. And yeah, absolutely take steps to try and reduce the impact that has on your dog. But yeah, if you're noticing anything else in your dog, if they do something in particular and it seems to cause them problems, for example, every time they're jumping up on the sofa or climbing up on the sofa, then, stop them getting on the sofa or have a little kind of steps up there, depending on their size, if that's something that you can do for them to make their life a little bit easier. So, it all comes down to keeping a close eye on your dog, to monitoring them for their comfort levels and taking steps, whatever those steps are. It's not just drugs. Absolutely. I think anyone, who manages arthritis on a regular basis is going to say that we need to take a multimodal approach. And that means we need to tackle the disease from all of these different angles that are available to us, because if we can take lots of different steps that act in different ways, then we're going to be able to have a much bigger impact on controlling the arthritis and kind of keeping our patients, in my case, or our pets, in your case, more comfortable and as comfortable as possible. So that's it for this episode of Call the Vet. I hope it answered some of the common questions that you might have had about arthritis. If you've got any questions for me to follow up, please just head over to callthevet.org and let me know, and I'll try my best to answer any of your questions. It doesn't have to do with arthritis at all. It could be anything to do about how you're looking after your pet, about any condition that you're worried about, maybe they're suffering from, or you want to try and prevent, or how best to treat them with whatever life throws their way. So if you enjoy this podcast, again, make sure that you're subscribed so you don't miss out on future episodes. And if you are a regular listener, I'd appreciate it so much if you could leave me a review over on iTunes or at ourpetshealth.com/review. Reviews are so important with other people discovering this podcast and help more than you can imagine. So if you could take a couple of minutes, I'd appreciate it so much. But until next time, that's it from me. I'm Dr. Alex. This is Call the Vet. Take care.
You've been listening to Call the Vet. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show that answers all of your pet questions.